Welcome and thank you for taking the opportunity to watch this short presentation on the Rannerdale Veterans Care Competency Assessment Program. Our program at Rannerdale is designed to provide a supportive, quality learning environment to assist students to succeed, provide a strong pastoral support program for students, to be able to integrate theory with clinical supervision, and we also provide student accommodation on site for overseas students. My name is Steve Shamey and I'm the General Manager, and over this period of the short presentation we will provide you information about our program, including the program structure and the content, so that you will have a better idea about what is involved in undertaking a competency assessment program at Rannerdale, in order for you to be able to make a decision if we are the facility that you would like to do this at. Thank you.
My name is Christine. I'm the Clinical Nurse Manager and CAP Coordinator of Rannerdale. Rannerdale is a 65-bed hospital and rest home. We cater for people suffering from serious medical illness, palliative care, which is in the last stages of their life, and people with dual diagnosis. That is, people who have a serious medical illness but also an underlying mental illness. Back in February 2010 was when we first commenced the Competency Assessment Program. This was to give overseas nurses the ability to be able to demonstrate that they met the Nursing Council of New Zealand competencies and could practice in New Zealand. Since its inception, we have had approximately 140 overseas students going through our program, all of which have got some excellent jobs in some of our leading hospitals in New Zealand, both in intensive care, neuro, operating theatre, accident and emergency, and general medical wards. The students have all successfully obtained jobs since getting to New Zealand. Some of them have chosen to stay in aged care because it's an area where they feel that their skills can be fully utilised. For those people overseas who are looking at maybe coming to New Zealand to do nursing, I would really suggest the first place you start is viewing the Nursing Council competencies. This is what you're measured on when you come to do your competency test in New Zealand. The program what we run is an 8 to 12 week program. For the first 2 weeks it is a lot of theory, but after 2 weeks you go into your practical. That's where you're working directly hands-on care with your patients. Sometimes students can finish this program in 6 weeks, so the whole duration of the course is 8 weeks. However, there has been times we have had to keep students back for an additional 4 weeks. That doesn't mean to say that they fail the course. It just means that they need a little bit more support in getting used to the New Zealand way of doing things. All your practical is done on the ward, so you don't have to go out to other hospitals to get your practical component. And you are assigned a preceptor who will work very, very closely with you. I work closely on the floor with the students, and I would like to think that we use a real supportive approach where students can actually come and speak to me if they're having any issues or if they're finding some of the competencies a little bit difficult to demonstrate how they are meeting them. I think Rannerdale's course is quite superb because we are a very supportive environment. We love having overseas students, and I know that nursing in New Zealand, from the students who have gone out and got jobs in the main hospital, is enhanced by your contribution to New Zealand society. You all bring with you your own cultural beliefs, and believe me, I say it all the time, we are enhanced by some of the cultural differences what you bring to us, for which I thank you. For those of you who are contemplating coming to New Zealand, I wish you well, and I hope you come to Rannerdale and we will all get to meet soon.
New Zealand has a population of 4 million. Our health system is publicly funded through the taxation system. We have a small private healthcare sector where elective surgery through private health insurance is undertaken. Secondary or hospital-based and primary healthcare services are funded through district health boards on a population-based funding formula. There is a very strong multidisciplinary focus to our healthcare system in New Zealand, which is heavily regulated to protect patients who come through the system. The aims of the competency assessment program are to assess overseas registered nurses who are applying for New Zealand nursing registration, and to see whether they meet the competencies required in order to practice as a registered nurse in New Zealand. Further information about this may be obtained by going on the web and googling www.nursingcouncil.org.New Zealand. Requirements for entry into the competency assessment program are to meet the New Zealand Nursing Council minimum requirements of an undergraduate nursing degree, evidence of at least 2 years postgraduate clinical nursing experience in a hospital environment, to meet the Nursing Council Code of Professional Conduct requirements, and evidence of proficiency in spoken and written English. Rannerdale offers 4 competency assessment programs over the academic year. Each program is structured to run for a minimum of 8 weeks. However, students do have up to 12 weeks to complete the required competencies. If they do not meet the required competencies in that period, they will not pass the program. It has been our experience that all overseas students that have undertaken the competency assessment program at Rannerdale have met the competencies within that 12-week period. On commencement of the program, students will complete a 1-day orientation followed by a block of classroom tutorials, a total of 56 hours. Following the theoretical block of lectures, students complete 160 hours of clinical placement at Rannerdale in our hospital. Students are allocated a registered nurse preceptor Each registered nurse preceptor has 3 students. Students will attend one external run course, which is a cardiopulmonary resuscitation training day as part of the competency assessment program. Program content. Program content includes cultural safety, the Treaty of Waitangi, manual handling, CPR, restraint minimisation, risk management, wound care, infection control, legal and documentation requirements, health and disability advocacy service and legislation in New Zealand, mental health, physical assessment, cardiovascular systems, medication dispensing, and pharmacology. In addition, students are required to complete self-learning packages on various legislation pertaining to healthcare in New Zealand. Presentation is giving you enough information for you to be able to make a decision as to whether you would like to undertake the competency assessment program at Rannerdale Veterans Care in order for you to be able to practice as a registered nurse in New Zealand. For further inquiries, we encourage you to visit our website at www.rannerdale.co.nz. Thank you.